Opioid overdoses it's a terrifying reality of our time. But what if I told you there's a scientific marvel that can literally pull someone back from the brink of death in just a few minutes? Today, we're going to dive into the incredible science behind that reversal.
I mean, it really does sound like something straight out of sci-fi, right? A person can be moments from death, and then boom, with a single dose of a medication, they're brought back. How on earth is that even possible? Well, let's find out. Okay, so to really get a handle on the solution, we've got to start with the problem. And that begins with understanding the complex and kind of dual nature of opioids themselves.
So let's start with the basics. What are opioids? We hear that word thrown around all the time. It's a really broad class of drugs. It includes prescription painkillers you probably heard of, like oxycodone, but it also covers illegal substances like heroin and the incredibly potent and dangerous fentanyl. And this is where you get this total paradox. On one hand, opioids are, frankly, medical miracles. They can manage severe pain in a way that few other drugs can. But on the other hand, the very same thing that makes them so effective can also be lethal. In high doses, they can shut down our most basic vital function, our body's own drive to breathe. So let's get into the nitty-gritty. What is actually happening inside someone's body during an overdose? It's a fast-moving biological chain reaction that leads straight to respiratory failure. Okay, let's break this down step by step. First, opioids enter the body and bind to these specific little docking stations in our brain called receptors. Now, in an overdose, a flood of opioids activates way too many of these receptors at once. This just overwhelms the part of our brain that controls breathing, sending it this powerful signal to slow way down. Breathing gets really shallow, sporadic, and eventually it can just stop altogether. And this right here, this is a really, really important point. While the drug is what kicks off this whole chain reaction, the thing that actually causes death in an overdose isn't the substance itself. It's the catastrophic lack of oxygen that happens when the breathing stops. So all of that chaos happening inside the body, it starts to show up on the outside in some really clear, observable ways. The pupils shrink down to the size of a pinpoint. The person becomes totally unresponsive. And as those oxygen levels plummet, their skin might start to look pale or even bluish. These are the telltale signs that an overdose is happening right now. But here's the thing. Even as this terrible cascade is unfolding, there's a way to hit the brakes. A medication that can stop this whole process right in its tracks, turning a potential tragedy into a story of hope. And that medication is called Naloxone. You might have heard of it. Its entire purpose, its only job, is to reverse the effects of an opioid overdose, and it does it with incredible speed. So how does it pull off this incredible rescue? Well, you can think of it like a battle that's happening for those brain receptors. See, the opioids are sitting on them, gumming up the works, and causing the breathing to slow down. But naloxone is a much stronger competitor. It has what's called a higher affinity for these receptors, which basically means it can literally knock the opioids right off and take their place, blocking them from causing any more harm. And the crazy part is, the effect is almost instant. As soon as those opioids get kicked off the receptors, the brain's breathing center is free again. It springs back into action, and normal breathing can be restored, a lot of the time within just a couple of minutes. It's a true lifesaver. Okay, but this is a huge but. We have to be crystal clear about something. Naloxone is not a cure. It's an emergency intervention. It's a bridge to get someone to safety, but the danger is definitely not over yet. This really says it all, doesn't it? The life-saving effect of naloxone is temporary. It buys time, precious time, but it doesn't solve the underlying problem. And here's the really critical reason why that is. A lot of opioids can hang around in the body for a lot longer than naloxone does. So what happens when the naloxone wears off? Well, the opioids that are still in the system can just latch back onto those brain receptors, and the person can slip right back into an overdose. That's why getting professional medical help immediately is absolutely 100% essential after any suspected overdose. All right, so we've covered a lot of ground here, from the scary depths of an overdose all the way to the amazing science of its reversal. Let's just quickly recap the most important takeaways. Okay, let's tie this all together nice and neat. The problem? An overdose. Opioids overwhelm the brain's receptors, they stop the breathing, and you see key signs like pinpoint pupils and bluish skin. The solution? Naloxone. It swoops in, displaces those opioids, and rapidly gets the breathing started again. But the result is the most important part to remember. Naloxone is a temporary fix. It's a bridge to survival, but getting that person to a doctor or a hospital is still absolutely vital. So we've walked through the science of how an overdose can be, well, miraculously reversed. And understanding all this is a huge first step. But it also kind of makes you wonder, right? Now that we know the science, what's our next step in tackling this crisis?